Welcome to the Aid Market Podcast, where foreign aid partners connect to learn about key funding trends and market insight. The podcast is co-hosted by Aid Connect Data, the pipeline and market intel software for USAID partnering, and Connected International, the leading USAID partnering support consulting firm. Now, here's your host, Mike Shanley.
Welcome to the Aid Market Podcast. I'm your host, Mike Shanley. Today, our guest is Dr. Alma Golden. Dr. Golden is a pediatrician who currently serves as COO and Director of Global Health for the Institute for Women's Health. Previously, she served as the Senate-Confirmed Presidential Appointee under Trump I at USAID to lead the Bureau for Global Health at USAID. In that role, she oversaw USAID's Global Health response to the COVID pandemic, directed the offices of maternal and child health, HIV/AIDS, as well as other critical health programs. Dr. Golden, welcome to the Aid Market Podcast. Thank you for taking some time to join us today.
Thank you so much. It's an honor to be here, and I'm excited to be able to share about global health as well as USAID. It was a great opportunity to serve during those years. Thank you.
Wonderful. Well, let's get right into that. Could you share a bit about what your role was under Trump I, leading global health activities at USAID?
Well, I actually had the opportunity to work in two different bureaus during the time I was there. I was invited into Global Health and had worked there for a year, and then I was nominated by the White House to be the Assistant Administrator over Global Health. And during that time, I served as the Executive Director for the Development Lab. So both bureaus are dear to my heart, even though the Development Lab has now been merged into other bureaus at this time. So in terms of what were some interesting things that I did during those years with Global Health, first of all, I think it's fair to say that one of my great loves is maternal child health, because as a pediatrician, that is kind of my comfort zone, is working with families, with children, and looking at not only health problems and outcomes, but what are the systems that it takes in order to get things done. I had actually run a maternal child health system for the University of Texas Medical Branch for a little over a decade, and some of those issues in indigent and immigrant care in Texas and far south and east Texas actually have a lot of familiarity to a lot of international issues as well. So it was really fun to get to work on that. I will tell you, though, that one of the adventures, and I'm just going to call it an adventure, was being at Global Health during the pandemic. That was a very sobering experience to have an opportunity to work on pandemic responses during such a global crisis. And I really appreciated the expertise that we had. We have had a number of folks that really just gathered together. We collected a few more experts as well to help support with such an unusual time. But it really was a remarkable experience. There were several things that were really unique on that. We had the responsibility out of the White House to distribute ventilators, for instance. And that was during the period of time where there was great hope that ventilators would really improve outcomes. But getting enough ventilators, getting them to where they matched the electrical systems and the regulations, and then assuring that there was actually adequate electricity, oxygen, purified water, and especially trained personnel for that. All those were fascinating challenges that were very rewarding to work with some of the experts that we have in global health. Particularly, I'm going to give a shout out to Dr. Rubenhorst, the deputy that worked with me. She's also a physician. She's an OB-GYN, and it was helpful to have personnel that were experienced in terms of not only systems, but also patient care during that time. So that was very, very interesting. And it exposed some weaknesses, not only in our distribution systems and our training systems, but it also exposed some really important information in the field. What we saw was where the countries that already had a system, that already understood how to do distribution, how to do training, they did so much better than the countries that were fragmented and siloed in their care. So that was the experience of global health. And I wanted to say a real quick shout out about the lab, the development lab, because that's where we focused on innovations. But that was a place where I got to work with Randy Tift on NPI issues. We worked on financing, which was new to me, in development, but very, very informative. And then we also had other very innovative programs like on education and so forth. So both experiences were great, and I'm honored to have been able to serve in that role.
And when the COVID pandemic began, at the start, how did that affect the USAID Global Health priorities? Did it reinforce the strategies and priorities you had in place, or did it cause a rethink of them? It'd be interesting to kind of take some of us, because many of the listeners never have worked inside USAID, how that thinking evolves internally at USAID when a crisis like that happens.
Well, I think that one of the things that we saw is that we had a number of the NGOs that were embedded in countries and where they had US or European healthcare providers or administrators or whatever working in the field. When the pandemic hit, many of those people were returned to their home countries. And so it almost reinforced the concept that we really do need to do localization, because you needed to have people in the field who lived there, who belonged there, who weren't going to be pulled back in to another country when something critical happens. So the crisis itself taught us a lot about how important it is to have a sustainability and the local expertise and a well-functioning administration system that we want in localization.
With that, let's stay on that thread then as we look at Trump II coming into office. This is being recorded right shortly before the inauguration, will be released right after Trump II's inauguration. Localization, would love to hear your thoughts on what policies from Trump I and that you've seen from Biden's under Samantha Power that you anticipate being continued or accelerated, and maybe some shifts or some changes to those policies and priorities at USAID in the global health space.
Well, I'd probably want to start off with what Mark Green, with the help of Bill Steiger, really promoted in Trump I, and that is the journey to self-reliance. That was something we talked about at virtually every one of the staff meetings that we had at the administration level. Mark was very, very clear on trying to establish a USAID that really saw self-reliance and sustainability as the core mission. We're not there to do this forever. We want to actually fulfill the mission that USAID has to foster sustainable development and advance human dignity globally. He had a genuine handle on that. And so the localization was all framed basically in the J2SR policies that were promoted. One of the things I loved about that is that it demonstrated a respect for the countries. There was willing to take them where they are without judgment and to appreciate their own strengths. And I think that's reflected in the country roadmaps as well. Those were established back then. I was delighted to see that they're still being maintained at this point in time. So the country roadmaps are helpful. They have metrics for both commitment to principles that are important to USAID and capacity to care for their own citizens. So it was really, that really informs the whole concept about localization, because you want to build up the ability of each country to care for the people that live there. And that has been, that really sharpened our focus on private sector and also on faith-based organizations. So I anticipate that kind of priority is going to be continued. I have 4 other areas that I thought about that might be important areas in the next Trump administration. And one of them has to do with integration. As you know, global health and much of aid was built on responding to a crisis or a big, big problem. So we have had funding and programs around things all the way back to smallpox and polio and malnutrition and malaria and maternal child mortality, and then HIV/AIDS and so forth, even the neglected tropical diseases and those kind of things. So we've funded and managed siloed programs for a long time. And one of the things that I anticipate that we're going to see is a strengthening of integration across these programs. And that is actually going to require some integration inside USAID too, working between bureaus, working between offices inside of a bureau, and then working outside of the agency with State Department, with MCC, with DFC, all of those groups. So this is an opportunity to really leverage and strengthen those systems. One great example on that, and this goes back to the pandemic just a little bit, is the strengths of our presidential initiatives, the malaria and HIV. For instance, HIV had all those wonderful labs that were set up everywhere, and being able to leverage those in a pandemic was really important. And we need to look for ways to leverage that also to the broader healthcare system. I think a lot of people have their eyes on that. I think some things have already been done on that, but I expect to see some really beautiful integration between the presidential initiatives and the other activities as well. One reason this is so important is that the countries themselves need a model for how to run their own sustainable systems, and they're probably not going to run siloed systems for every funded priority. You don't send 4 different community health workers out into a village to get data. It'd be better to send one who can collect the data on all of those things. One of the phrases that I used a lot, I think probably Global Health got tired of it, is it's time to treat people, not problems. We really want to focus on individuals and families, not just the disease process. And so I really have an optimism about that moving forward. The other thing about it is we want to treat people as whole people. This came up in the pandemic also. We didn't have good systems for addressing the mental health problems that were happening. And so I want us to really see people as having a physical component, but also the intellectual and economic component, the emotional response, their social response, and even their spiritual well-being. Along the lines of the spiritual well-being, I want to remind folks that in October of 2020, we had a faith-based and evidence summit on working with religious groups and faith-based groups. Beautiful summit with lots of great data that shows how valuable it is to incorporate faith groups into our development response. They're more trusted. Some of them have been there 100 or 150 years. They were there a long time before USAID showed up. And they have done a good job in terms of managing their costs and maximizing their effectiveness. So in terms of the integration, I also expect that to be a real issue, and also a better way to treat whole people, all of them, the mental health, the physical, their social, and intellectual as well. The third area I think that we can look at and expect to see some changes in, and I will just acknowledge that Bill Steiger did a great job of addressing this in the October um, podcast that he did, but he really promotes, and I think it will be a pattern that we want a very efficient global USAID. He actually delineated some of the ideas in terms of how to help our staff to have more productive experiences, feel less frustrated, leverage AI and other technical components. So I expect that to be a big part. The procurement improvement, is gonna be a very important piece. We spend a lot of time working on supply chains and procurement issues, and I really am hopeful that that all moves forward really well. And then I also, in terms of improving the agency, I really want to see an increase in things along the lines of, like one project is called Hearth, HEARTH, and it's in the show notes. But it really does a wonderful job of coordinating not only the health and education, but also agricultural and just environmental improvements too. And like one example is a cocoa project that actually uses Nestle and Costco and Hershey's, and it's some from USAID, but then it's got private sector involvement, produces employment, and also helps with the forest and so forth. We're also going to look toward performance-based results. I think that the experiences we've had with DFC and MCC are instructive, and I think we can use some of those. And the lastly, not quite last, on international organizations. I do expect there to be a real focus on accountability and transparency. I also think there's going to be some really interesting challenges in terms of U.S. voices in those environments. We want to be heard. We want to be a part of the discussion, even if we don't always say the same thing everybody else does. So I do think that's going to be where we request cooperation and respect as U.S. Members of those organizations. And I think we have a risk of not being as engaged in those if we don't have the cooperation. And then we do anticipate protecting life and in public and foreign affairs, or like we called it PLGHA last time. And that's an easy thing for me to talk about because I'm a pediatrician and a grandma, and I love to see us take care of women and babies. And so many of these women they really want healthy pregnancies and healthy opportunities as well. So I do expect to see that put back in place.
So many interesting points to follow up on. Let's go with new partnerships initiative first. So faith-based groups, localization in there as well, private sector, obviously with Rubio nominated, potentially confirmed by the time this comes out. And when he was in the Senate, he was a strong supporter of the new partnerships initiative. I'm very interested to hear, what do you think from designing and launching that and then watching the power administrator power continue it? What have you learned, or what do you think the administration's learned that might be emphasized further in Trump II, or might be, reprioritized, or changes that might go to be incorporated into the new partnerships initiative under Trump II, assuming they continue it, which again, seems likely if it's the same personnel and the supporters of it will be part of Trump II.
Well, the first thing I want to do is give kudos to Samantha Power and USAID for continuing to focus on localization. It's now been through multiple administrations, and that's really important. We've got to set the pattern, and we learn from each different group. So I think that's important. And I understand that there's going to be a report out today. I haven't had a chance to look for it yet on their localization progress report, but for this past calendar year. But so pleased that that's continuing. I think that there are a couple of things that I would mention. I think that you may see the definition of localization really, that hopefully we're going to be able to hone in on that even continuously. I anticipate that in the next year, possibly even shorter, the definition may be changed a little bit from what it was in the Biden administration and moved back toward a little bit more of the focus, more confirmation that it's truly locally based and not an extension of a larger NGO. That kind of thing may actually be one change. But I think overall it's excellent that it's happened. Back when Randy Tifton and I were chairing an NPI committee to help design some of the NPI work, we really had one of the things that came up is that it's hard to get new grantees in if they don't know how to apply and they don't have the basic organizational structure that's required by our regulations or even funding requirements. So one thing that we did late in 2019, and then it kind of got obscured by the pandemic, was to develop what we call the NPI incubator. The concept behind that, and we did make an award. I couldn't find information on the web when I looked for that earlier this week to verify if it's still there. But the idea was to be able to really help on the ground groups that should be partners somehow with USAID to have the support so that they know how to write a successful grant, that we've reduced the barriers to entry so that they can get in and actually contribute, and then so that they can be successful in delivering services and providing reports, because that can be really time consuming and rather intimidating. There's a lot we require. So I'm going to just give a couple of examples of things that I think could be new partners. One of them is a midwifery center that is in the Democratic Republic of Congo that was actually developed by a midwife there who lost her mother and I think some other friends at delivery. And she decided that that couldn't happen again. And she went and got trained, and she's trained others, but she's never gotten a grant, and they have a beautiful record of maternal survival, but we haven't found them yet, that kind of thing. Another one is something called ACQUIRE. It's the Africa Consortium for Quality in Research, and it's in sub-Saharan Africa, and it's very consistent with our goals. But again, a fairly new entity, and as far as I know, it's not been funded yet by USAID. So I think that as Africa develops, as the whole world develops, there are organizations that we could leverage our funding in very smart ways to strengthen the J2SR sustainability concept. So I would tell you that there's another area that I think would be really good and that I expect to see that's a change, and that is the things like the American Schools and Hospital Association, where you actually help create the partnerships. I was talking to somebody from Egypt earlier this week, and they have at Galala University and Arizona State University you can get a dual degree from both. And that's the kind of thing that I think is so exciting and would be such a smart use of our work. One last thing, and that is I think we are aiming toward really smart recruitment. We have not recruited well from the middle of the heartland of the U.S. for employees. We have very few employees that come from Native American universities, faith-based universities, and I think strengthening recruitment and broadening our employee groups, I think, will be an exciting opportunity.
Thanks, Alma. Again, a lot of interesting things to follow up on. One just thought is on localization. I see like one of the challenges is, of course, is it's harder to give out 100 small grants than it is to give out $100 million. Here's a contract to a big prime, 100 million bucks.
Yeah.
USAID has short staff, maybe, hopefully. And again, with the Bill Steiger had some interesting ideas. And Jamie Rogers was on as well, the chief acquisition officer, how we can use AI to make things more efficient. So hopefully there's some things there. I'd love just to get your take on, I mean, that's got to be a barrier. Maybe the technology can help, but what are your thoughts on, is that the main barrier to effective localization? Are there other ones that come to mind?
Well, I think that's one of the big ones. And that's when Randy and I were chairing the committee from multiple bureaus on NPI, that was one that came up over and over, is that it takes just as much energy to manage a $1 million grant as a $100 million grant. And when you have limited staffing in the field, I understand that issue. That's worrisome. One of the things that we talked about then, and I'm sure is being discussed since then, is the possibility of smart umbrella grants. And now, and associated with that, having a diminishing amount, maybe it does start off with an NGO that has an umbrella grant and has multiple local partners under it. I think the key on that is to go ahead and take it from where the NGO has a significant percentage of the award, and the large NGO is mandated under the grant to diminish their amount that they can have and move more of the resources and the responsibilities to the smaller grant. So I see that as an important thing to use, as well as sort of supplementing our field staff.
Great. Well, quick last question then, Alma. We want to get into hearing about what important work you're doing now. In the interest of aid effectiveness, what is your so what for global health organizations that are supporting USAID's mission and are interested in continuing to support, ideally grow their support of USAID under Trump II? What would your advice to them be to how, leave it that broadly? What's your advice to organizations that want to work more with USAID under Trump II on the global health space?
Number one, always keep the vision of J2SR. That's why you're there. That's why you're being funded. Then we're going for sustainability, not continuity, to where things stay the same. Number two, be sure that you're doing multi-sector work. Look for ways to do integration, look for who your partners are, so that you're addressing maybe not just health, but you really are supporting other things along schooling, career, and other things like that. Be sure that your barriers to entry when working with those local partners are not extraordinary. Be sure that you make it easy for them to work with you. Also, hopefully the incubator is still there. If not, then you need to turn into an incubator yourself and think about the possibility of actually working yourself out of a job. Also, be sure that you read the country roadmaps that were already there, recognize what the metrics are, and be sure that you're actually incorporating them into your planning and into your activities.
Great. Very useful. Thank you. Now, Alma, tell us about the work that you're leading right now and how organizations and partners can get in touch with you and your team.
Outstanding. Thank you for that opportunity. I'm working with the Institute for Women's Health, and I'm getting to do something I've always wanted to do, and that is look at care for people across the lifespan. I'm with as the Institute for Women's Health, we really care about not just one little segment of the health system, but also like I said before, the physical, the intellectual, the emotional, social, and spiritual. And we're looking at it from the first 1,000 days, from conception to end of life. We want women to be healthy through that whole experience. And that means that you need to have a balanced view on that. So it was my privilege to be the architect and kind of the gray hair on the Women's Optimal Health Framework. And we have medical and health personnel from here in the United States, but also a wonderful health council that's international from all over the world that helped to develop this framework. It has two major sections in it, and there are links in the show notes on how to find it. But the first section is actually on concept notes. We identified 9 specific areas that are associated with improved health outcomes in countries. And those concept notes, you just click on that, and it has not only the information, it has the research. Every underlined word is connected to research. And so that gives some really good ideas for policymakers as well as health system people. And then then the second section are health interventions that are associated with improved health outcomes. And that is in the different age groups. And again, it's all linked research and resources. We have over 1,000 resources that are identified. So we're having a great time doing that, getting started on an education framework that will be out later this spring. And I'm having a lot of fun doing that. And it's back to my whole concept of let's treat people, not just conditions and problems.
Alma, thank you so much. Again, all of the check the show notes for the links for those reports to read more about Alma's work and to get in touch with her and her team. So Alma, thank you for sharing that insight. And really in terms of, as again, innate effectiveness, we want organizations to be more efficient at the organizational and the USAID partnering level. So really appreciate you being on here to share your insight and how they can best support USAID's priorities as we enter Trump II. So thank you for being on the Aid Market Podcast today. Really appreciate your insight.
Thank you so much. Happy New Year.
Take care.
Happy New Year. Thank you.
Thank you for tuning in to the Aid Market Podcast. If you enjoyed today's show, be sure to subscribe wherever you get your podcasts and connect with Mike Shanley on LinkedIn to stay updated on the latest USAID funding trends.